Hello everyone and welcome back to Politics Relaxed podcast. A bit smaller today because it's New Year's Day, so thank you everyone, especially for turning up today. Today we're going to be talking again about coronavirus. I mean, there's not really much else you can talk about because so much going on again. It seems like that it's really picked up again, especially because of this new variant. And I kind of want to start with that, to be honest. So the new variant, do we need more measures in place? Because the infections are going up, the admissions to hospitals are going up. Do we need more? Measures, or is it working? Just anybody put in the chat.
Yeah, well, you may remember a few weeks ago, I was pretty scathing of these new restrictions, the whole Tier 4 thing that we were moving into here in London and Surrey. I think over the last few weeks, the situation has really worsened. We can see that with this new strain that can be transmitted so easily. We're clearly facing big issues like the NHS potentially being overwhelmed. And I think when I can try and reflect what I was saying before about the effectiveness of lockdowns, I think one thing I've noticed, especially this time in the last few weeks, which is definitely limiting the effectiveness of lockdowns, it's been the fact that because we're closing off so much space, we're closing off cafes, restaurants, shopping centres, shops, massive spaces. We are funneling people into outdoor spaces. And one thing I've noticed a lot recently, if you just walk around, you can observe it in society, loads of people bunched together outside because the only thing people can do is go for a walk, all right? So what we need to do is clearly, we need to fix that for a start. I don't know how, but we need to limit the space where people can transmit, and at the moment we're limiting it too far, and therefore we are funneling people into spaces where they are then gathering in big crowds accidentally, of course. And I think that now that we're seeing this massive rise in cases, we're seeing the potential for the NHS to be overwhelmed. This calls, of course, for greater restrictions, and I have to understand that and appreciate that now, because we're really at breaking point. I think the NHS is at breaking point, and I think therefore you kind of have to go all in now. And basically what we're looking at in the next few months is, if we stay with the restrictions we've got at the moment, the tier system, our economy is going to be ruined anyway. So if you're going to ruin the economy, you may as well do it with the most effective lockdown, right? And the most effective lockdown, to be clear, would involve everything shutting, really limiting the potential for the virus to transmit. And it's awful to think about, and there are so many human impacts, but the most important thing is that we get this 24-hour vaccinating going on. We need the vaccination rollout to be as fast as possible so that we can get back to normal as fast as possible. But in the short term, it's looking pretty bad, and we're going to be under severe restrictions. So our economy, human impacts will be pretty negative.
Sure, a very different message from 2 weeks ago when we were talking about tier 4, and I'm glad you admitted you're wrong there, because I was going to tear into you for what you said. And I do have one problem though with what you're saying about the cafes, because if we look at the transmission rate, so less than 10% of reported global cases have come from outdoor, and indoor transmissions were 18.7% higher. So opening cafes, restaurants, indoor facilities is not the answer to people bunching out. In fact, I don't think people should be like in big groups really, unless they're in the same household. It doesn't make sense. So it can't be that big a groups unless it was a few weeks ago. They shouldn't be breaking the rules, and that's what we've seen over the last few weeks. We've seen huge rule breaking, and According to Montgomery, who was on BBC Five Live the other day, he said 50% of people might not know they have the virus. So we're at a very volatile time, especially for the NHS. And it comes to a greater problem of the lack of funding from the NHS. And this is what we've seen throughout the pandemic. We have seen the effects of Tory cuts on the NHS for the last 10 years. Daniel.
I think there's kind of two ways people are thinking, and me as well, about this whole coronavirus situation. There's the way we want, which if it was like people would, I'm trying to figure out to explain. There's the way we like, and we would want it, which is reopen everything and just ignore the virus. But we can't do that, obviously, because the vulnerable people would suffer from it really badly. But I think the right thing to do would be that the Tories put in a 2-month lockdown, like a full lockdown like we saw in March, and just while everyone gets the vaccines and all that. I saw from a news article, I think it was either BBC or Sky, and there was this company that developed like a drug or a medicine that would give you instant immunity to corona. So they're gonna test that. I don't know, obviously, how hard it is, like how accessible that medicine is, and if it costs a lot. But I did see that. So hopefully, that can easily be like rolled out and all that, because there'd be the vaccines. I think we've got two different types that we're gonna have in the UK. We've already got the Pfizer one. We'll have the second vaccine, and if that medicine that gives you instant immunity does work, then that'll be brilliant, because it'll help a lot. But in the meantime, until we get all these like medicines and vaccines out to at least all the vulnerable people there are, I think we should be in a lockdown, because the new type of COVID is just spreading way too quickly, and the cases are the new cases are much higher than we've ever seen before.
All right. So Daniel Jones, last week on your Instagram, I saw you very scathing. You said you wouldn't follow the latest restrictions, Tier 4, put in by the government. Have you changed your mind, or are you still adamant to these restrictions?
Well, at first I was obviously quite annoyed about it. I couldn't see my family. I had plans to meet my aunt, but I now know that they were needed. And even with these new restrictions, cases in my local area are going up, and around the country and around Europe. So I have followed the rules and everything, but it.
Yeah. There has been a bit of misunderstanding about the new variant, I think, because people have thought it's a bit less potent. It isn't. It's about the same severity, but it's a lot higher transmission rate, especially in we've seen it in younger people, especially. I'll go to Cameron now.
Yeah, I want to pick up on one thing I heard there, which is quite interesting, which Daniel said, which was about how despite the new restrictions, cases continue rising. And this is something that I think we've seen across the entirety of the year since the actual full proper lockdown back in spring. And I think that was the only measure that brought cases down. It's become clear that these the tier restrictions and the kind of the weaker lockdown that we had a month or two ago, they've not been anywhere near as effective. In fact, they've barely brought the cases down at all, and the death numbers therefore have not been brought down significantly. And I think this all kind of adds to the point I was making earlier, which was that if you're going to go for a lockdown, if you're going to say we're going to trash our economy, we're going to ruin people's lives for another few months, you may as well do it properly, and you may as well have the impact that you actually want to produce, because otherwise we're ruining our lives, we're ruining our economy, and at the same time it's not affecting the case rate or the death rate. So why are we doing it?
If you actually
So
look,
yeah,
if you look at hospital admissions though, because that is it's a good measure of because for deaths, like it's a very different from country to country on what counts as a death and what doesn't. Hospital admissions is a very stable way to measure it. And I've just got the figures up in front of me right now, and if you can look at it, you can see there is a dip after that second lockdown, which wasn't as it wasn't nowhere near as strong as the first one, but it was still it made a dent on hospital admissions. But with this new variant, it's gone out of control. And from the very start, I and Labour have said on here, I have said the tier system does not work. And you defended the tier system at first. You were like, the tier system works, but you again have been proven wrong. You were proven wrong by tier 4, and now you've been proven wrong about the tier system. They do not work, and this government have to listen to the scientific advice. They make out they're listening to the scientific advice, but they are not listening to the scientific advice like they should. Daniel.
Well, at the start of the pandemic, we really didn't know what was going on. The government has made many mistakes, but these are hard times, and nobody's really faced such a hard time as we've had. 100 years ago in the flu pandemic in 1918, 200,000 British people died, and we've managed to keep these numbers down to around 70,000, and hopefully under a certain amount. So there's definitely great things that this government has done. They've kept they've kept the NHS from being overrun. They've helped the vaccine get distributed, but they've obviously made many mistakes that they need to be accountable for. But I think it's a great success story.
This is not a great success story. Have you seen the numbers in South Korea? Have you seen the number in New Zealand? Have you seen the number in Germany?
Yes,
look at Germany, okay? Germany's a perfect example.
Okay.
Look at a percentage of their GDP that goes to hospitals. The percentage that goes to hospitals is a lot more than ours.
Because we have a good value for money.
This Tory government
service,
if you look at it in real terms, because I hope that we all understand basic economics, which is inflation, correct? Everyone understands inflation here, right? And yes, okay. So if we look at it in terms of inflation, funding in terms of inflation, here we go. In terms of inflation, the government have been slowly decreasing funds. Here we go. So I can give you this, if you want to see the numbers, I'll give you the numbers. So here we go. It is a percentage of GDP spending on the NHS in 2009 was 7.59%. If we look at it in 2020 to 2021, it's 7.07%. They have slowly been taking out funds from the NHS. And then if we look at pays for doctors, because it's very important that we retain our doctors, and we haven't been retaining our doctors, and that is a huge problem. And it's because they haven't had a real term pay rise. If for 10 years they've had a 15% pay cut, if you look at it in terms of inflation, in terms of GDP. So we need to be retaining our doctors, and we need to be putting real funds into the NHS according to inflation. It needs to be increasing because we're facing a pandemic, a worldwide pandemic. There needs to be some sort of movement on the funding for the NHS. I don't want empty promises from this government again, like we hear all the time. The Tories' empty promises, once again, causing deaths to this country. We saw 100,000 deaths from austerity, and now we've seen 50,000 deaths from COVID-19. This is a Tory government problem.
Tory government has put in record funding.
No. I'm gonna have to interrupt you because I've just given you the facts. I have just given you the facts that in terms of GDP, the Tory government have cut funds from the NHS. They might have record funding, but inflation is up. Everyone understands basic economics. The inflation, all right? GDP, in terms of GDP, is what is important, because it doesn't matter whether I'm like, let me just give you something. In 1950, do you know how much we spent on the NHS? Sorry, in 1950 we spent 460 million pounds on the NHS. Now we spend over 340 times that. That does not mean that it's been record funded, because of course it's been record funded, but that means nothing in terms of inflation. Surely you understand that this is basic economics, and the Tory government has taken money out of the NHS. And we've seen that the doctors haven't had a pay cut for 10 years. In terms of real term pay cut, they have had a 15% pay loss in terms of inflation. Here we go. 4 out of 10 nurses are either using food banks or going hungry because our NHS professionals are not being paid for the skills that they earn. We cannot retain them. They're moving to Australia. They're moving to Canada. They're moving to places where they're taking our training basically and moving to other countries. And then, God, you've got to retain your staff and you've got to put enough money into the NHS, and that is not what's happening. And that's why we're facing one of the worst deaths per capita in terms of the world. That is why it's not just some magic thing that we have an older population. That is not an explanation when New Zealand, South Korea, Germany, they have funded their health services properly, and they have low cases, and they have leaders who know what they're doing. Tommy.
Yeah, I think a bit further on point from that is the funding of the nurses and doctors is very bad. I think a few years ago, Matt Hancock said to ITV that he would get like 40% more nurses or something into the sector. And then the ITV interviewer asked back, where are you going to get that from? The magic nurse tree. It's not cheap to fund. And I don't think the government is putting the right funding in the right places. They're not paying enough attention to the junior doctors, and that's why they go on strike. That's why they went on strike.
Yeah, and 30% of nurses, this is a study by ITV as well, 30% of nurses said they will leave the profession in the next 12 years. We're not retaining our health professionals that are some of the best in the world. Boris Johnson has talked about us being a scientific superpower. How can we be a scientific superpower when 30% of our nurses want to leave the profession? They might go to Canada. They might go to Australia. They might go to New Zealand, where our training still counts. Our training counts there. They can go and get trained as a nurse or a doctor and then get properly paid, where the country values them. Our country does not value our health professionals. We go outside and clap for them for 7 months, but do we value them? No. Cameron.
Okay, so I think we're going a little bit off the COVID thing here. And I think actually, if you look specifically, no, I know what you're thinking. I know what you're saying. You're saying that the reason we've suffered so badly is because the NHS has suffered under a Tory government. First of all, I wouldn't agree with that particular sentiment. However, okay, listen. Okay, so if we're going back to talking about COVID for 1 second, and let me just point out that I'm here defending the government that we have had in the last year and not governments before that. What we have seen is we've actually seen an increase of over 13,000 nurses and over 10,000 doctors now. So, okay, yes, there were cuts to numbers, and it was difficult to retain staff at times during the austerity governments. But that's what happens when you're dealing with a budget deficit of hundreds of billions of pounds. Unfortunately, now we are in a better economic position, or at least we were until the COVID economic hit us. But at the same time, it has to be commended that we've managed to, in the space of under a year, employ tens of thousands of doctors and nurses. And I think it's actually a very good, solid achievement for this government. Yes, nothing can change the fact that we've suffered in the staffing department when it comes to our national healthcare. But I don't agree with you when you say that this country doesn't value its healthcare staff. I don't think that the numbers actually reflect that at all. I don't think numbers can ever reflect a qualitative feeling.
No.
Actually, the feeling among the British people, and of course always among government, is that they want the best for a healthcare service. Okay, but no one foresaw a pandemic. So no one was planning a decade ago when the Conservatives were elected to reduce the budget deficit. And by the way, the NHS budget was not cut, despite what you might say with regards to inflation.
Yeah, in regards to inflation, it has it has decreased. It has decreased. And let's talk about how the nurses are feeling. The nurses are feeling hungry. 4 out of 10 nurses are not getting adequate meals. That is shocking. That is truly shocking for some of the people that have worked so hard during this pandemic, and 4 out of 10 of them cannot eat. That is a joke. And this Tory government are not doing anything about it. They might be adding these 10,000 nurses, but can you retain them? No, 30% are going to leave in the next year. Can you feed them? No, you can't. You can't even feed them. You won't even give them a pay rise for 10 years, a real term pay rise. This is embarrassing. We cannot retain our nurses. We cannot fund the NHS properly. This is embarrassing. They're going to other countries because we do not value our healthcare staff. We can clap all we want and we can give all these empty promises, but where are the nurses going to come from? And when are we going to pay them properly? That's the only way we're going to keep our nurses, is by paying them properly and by giving them a real term pay rise. And it's not happening.
How are you going to pay for the pay rise?
How am I going to pay for the? Oh, come on. All right. Do we really need to go into? Yeah. Okay. Let's go into this. So let's.
No, I'm happy to go into it.
Oh, okay. It's fine. It's fine. You asked for it. £350 million the Conservative Party Boris Johnson promised in the Brexit campaign to go to the NHS a week. So how come that money's just magically disappeared? Oh, right, because Brexit's going to cost the economy. It's cost the economy so far £130 billion. And about PPE contracts, so £11 billion went to companies either run by friends and associates of politicians in the Conservative Party or no prior experience of supplying PPE. Like, there is the money. The money is there.
The system,
it's going
has operated relatively smoothly.
It's going to Tory cronies, and it's going to people who have no experience of supplying PPE. Because let's talk about this. How about the Conservative Party cut the pandemic supply of PPE? Oh, the Conservative Party also were there under Operation Cygnus when we saw what the NHS could be overrun by a pandemic. All you have to do is look up Operation Cygnus, and then there it is. The Conservative Party, Jeremy Hunt was there. He witnessed Operation Cygnus. The NHS was going to be overrun if a pandemic hit. That's what it said. That was the findings of Operation Cygnus. So there is the evidence. The evidence is there. We do not value our NHS staff. And the Conservative Party have seen that the NHS is underfunded. It's depleted. It doesn't value its staff. And they've seen that a pandemic could be there. And they've done nothing about it. Absolutely nothing.
But the NHS has not been overrun yet, at least. We've seen in the last month, the NHS have survived for far longer than many people predicted and many people expected. So I don't accept that point. And if we can get back to the actual main point of this episode, to stop our NHS from being properly overwhelmed, we are going to have to introduce more severe measures, in my opinion, similar to the lockdown that we saw nearly a year ago now, to make sure that these restrictions we're bringing into place that are going to ruin people's lives and ruin our economy are having the desired effect. And I think what we're going to see, hopefully, from the government is this mass vaccine rollout. And I think that's really important. And at the end of the day, if we get this vaccine into people's arms in the next couple of months and we're back to normal in some shape or form by Easter, I think that would have been a good achievement by the government. So I hope that they can proceed to do that. But at the same time, we've got to make sure that these restrictions are having the desired effect.
I do agree. The NHS has not been overrun yet. But we have the fourth most deaths per capita. Is it the fourth? Yeah, I think it's the fourth. Wait, yeah, something like that. Fourth most deaths per capita per 100,000 in terms of the rest of the world. So there's obviously something going wrong. And I can tell you that something is the underfunding of the NHS. It's nothing else. And I'm going to read you an email from that was sent out to the Royal London Hospital staff. I'm going to quote. Let's have a look. We'd like to take this opportunity to reiterate the fact that we are now in disaster medicine mode. We can no longer provide high standard critical care because we cannot. That is what's going on. They cannot provide a good healthcare. And like Boris Johnson is talking about becoming a scientific superpower, sorry. And then we cannot provide high standard of critical care. I'm going to go to somebody else because I've talked for a long time. So Daniel Evans.
Can I just ask Dan Jones, how has this been a great success story for the Tories? Firstly, Boris put us into lockdown like 2-3 weeks too late in the first place. Studies showed from about September that if he had put us into lockdown 3 weeks earlier, we would have had half the deaths that we have now. So firstly, that's the big mess up from Boris. He's all like, oh yeah, we'll be fine. We're doing the right thing. No, you're not, because you've killed about an extra 33,000 people. Secondly, how is the UK the country with the 6th most deaths in the world and 4th country with the most deaths per capita in the world, yet we have a free healthcare services, and we're still doing really badly with those stats? 68,000 deaths in the UK because the Tories have messed up, and you can't avoid deaths, obviously. There's going to be some deaths, but they've got to do better. The first lockdown happened too late, and then they just go around making mistakes. They know they've made mistakes, and they won't apologise for them. For example, Dominic Cummings is basically Boris's advisor. What does he do? Goes to Barnard Castle, completely breaks lockdown when COVID was at its peak. And what happens? He won't apologise. Boris will take no action over it. Sorry, yeah, go on.
And Matt Hancock, live on LBC, he was asked, could he apologise to a person whose brother had died fighting in the NHS, helping to save lives, and he didn't apologise. He didn't apologise for the government's inaction on COVID-19. Yeah, back to you.
People were like, oh, this is the first time in ages. This is the first proper time we've had to deal with a pandemic. Of course, the government's going to make mistakes, and that's fair enough. But they've not learned from the mistakes. They've been doing them again and again and again. The tier system clearly isn't working. We should be in a full lockdown for the moment because 600 deaths. Today we got about 650 deaths. Yesterday was 950 deaths. And we're not in a lockdown. Why? They're messing this up so badly.
Yeah, and hospital admissions are up as well. They're in April levels now. And if you just look at the curves, you can see where it's going. It's on an upward trend and it's not slowing down. There needs to be a lockdown. You're completely correct. And this goes back to the bigger front that our NHS is being ruined by a Tory government. I'll let Daniel Jones respond.
Well, I don't think it's been an entire success. Governments have made many mistakes, and but we've been the first country in the world to get our vaccine approved. We're vaccinating more than 1 million a week. We're going to be vaccinating more than 1 million a week. We've avoided the NHS from collapsing. We've got the most testing in Europe, but the most important thing is that every single government has made many mistakes during this pandemic because nobody knew what to do. But this has been a success for the whole world. We could have seen tens of millions of deaths, but we've avoided that.
I take the vaccine point. The vaccine has been very well developed, and I commend this government for the vaccine. But that does not make up for any of the other mistakes. This has not been a great success because we have the 8th most deaths per capita, above the US, and the US have done hardly anything under Donald Trump. He's not fit to run the country, but that's beside the point. Let's talk about Test and Trace. Test and Trace run by Dido Harding. Dido Harding should not have been in charge of Test and Trace. She's not competent to do the job. On the Talk, she won a bronze. She won the Wooden Spoon Award for customer service. She has no experience in medicine or running things like that. She had no experience in. Okay, Tommy, I'll go to Tommy.
Yeah, just to Daniel Evans, I think he said that we should have been put into lockdown 2 weeks earlier. I think I've said this point to the past before, and I'll repeat it again. I think it's hard to slander the governments on not knowing what would have happened. I get that there was research there,
Oh, okay,
and
but let's talk about that, because I just want to talk about that, because the second lockdown, Keir Starmer called for it 3 weeks before, and then they didn't go into it for 3 weeks.
Yeah, but I'm talking about the first lockdown.
Okay, but then Daniel went on to say it would have been fine if that had been the first time they'd made the mistake, but it was the second time they.
Yeah, well, I agree with the points for the second lockdown. The government were trying to prove a point so that they knew how to handle it, but it ended up making them look worse at it. But I think it's very hard on the first lockdown. No one really knew. It was only 1 year ago in January that it was declared a health emergency for China and for regions nearby. It wasn't until about February, I think, that we got our first UK death. It would have been hard to foresee what would have happened. I do think that we went in a bit late. I do, but we get our ratings. We get our like 10 out of 10, 9 out of 10. We get told based on our decisions in the present day. We may look back at it in the future and think, whoa, that was a really awful decision. You shouldn't have done that. But you cannot see what people think in the future. You have to make decisions based on present day. And I think it's a bit harsh on them, even though the study was there.
Yeah, but that's the reason we have Cobra meetings, that Boris Johnson didn't turn up to the first 5 Cobra meetings. The World Health Organization declared a World Health emergency weeks and weeks before we went into lockdown. We knew this was going to be a terrible virus. We didn't know how bad, but we knew it was going to be bad. So, and that's the point. When China locked down, we saw we would probably need to lock down if we got cases, right? And that was probably inevitable. Of course, the benefit of hindsight, but even still, there should have been better action on the government. And that's why you don't have an incompetent government for people like Matt Hancock and people like Boris Johnson, people who cannot do their jobs properly. It's as simple as that. Daniel Evans.
Well, I'd like to make a bit of a comparison between the Tories and Arsenal this season, because the Tories, what are you laughing? It's going to be a valid point, you'll see. The Tories, before the lockdown, were like, oh yes, we're handling this the right way. Together we will defeat this virus. Just like Arsenal were saying last season, oh, next season we're going to be great. We've got Thomas Partey. So that's the first point. And then this country with COVID has been struggling, just like Arsenal, in a relegation battle, because the Tories have just messed everything up. The Tories, like Arteta, they're leading the country and they're making us struggle. And why? Because they're incompetent. Matt Hancock is clueless. Boris just has no idea what he's doing either. He just listens to Matt Hancock. Rishi Sunak has no idea what he's doing with finances and all that stuff. And it's even the education system, like the education part of it. Gavin Williamson, because of Corona, he's also shown, first he's a Tory, and he's shown that the Tories are incapable of handling crisis, because the GCSEs and A-levels were a crisis and they completely messed up the marking system and predicted grades, and loads of students were ripped off good grades.
You just forget the number of crises this government had been embroiled in. How many, does anybody even have the count for the amount of U-turns they've kept? I would understand if it was 3 or 4 U-turns. That'll be more than acceptable in a pandemic. But when it gets to 9 months, and when we have an understanding of the virus, you cannot keep making these mistakes. And Gavin Williamson will not even vote to feed hungry children. That is beside the point. But this government cannot do their job, and it's time for a new government. It's time for a Labour government. Cameron.
It's time to go.
Cameron.
Right. So I think we've just heard a lot of very bold and blanket statements, really. And I think actually we need to actually look at the reality and the facts. Okay. And I appreciate, yeah, this government has made U-turns. This government has made mistakes. The U-turns have been primarily to correct those mistakes. That's the point of a U-turn. If you look at the exams fiasco, for example, Okay, so that mistake was corrected within days, all right? It was a big mistake. Everyone knew it. Everyone could see it. The sentiment was correct in that the grades were going to be inflated without some kind of algorithm, but it was so badly messed up by the department that it didn't work out, okay? And it was impossible to formulate, it was impossible to formulate a proper algorithm that would have done this really successfully without discriminating against some groups, okay? And they did fix that within days. I believe that our test and trace system is running very smoothly. I've had a number of encounters with this system and I haven't had any problems. I don't know anyone that has, and I know, of course, a number of people who have also come into contact with this system. I know people that have got tested, I know people that have been traced, and I think the app is working successfully. So I think on that side, I don't think we're really having an issue. So I'm hearing a lot of blanket statements also about Rishi Sunak. Someone said, oh yeah, he's messed up everything financially. Okay, no, it's not true, is it? Okay, so because he's retained over 10 million jobs through the furlough scheme, and I believe nearly 5 million jobs through the self-employment scheme. On top of that, he's tried to stimulate our economy in its hardest times. So I'm not going to sit here and put up with everyone just making stupid blanket statements without any real justification. Because if you look at some of the things the government has done, and I will admit that they've made mistakes, we've also got a lot right. And that is why we are not top of the deaths per capita list. That's why we are 8th on that list, okay? And as I say, I don't like to use these numbers. It's horrible to use them, but if you're gonna use them, I'm gonna use them too. All right, so I feel as though we're being a little bit too harsh, and we're not kind of digging deep enough into it. And I think if we do that, perhaps what we'll see is that they've got a lot more right than you might originally see.
Oh yes, Boris Johnson's scientific superpower, 8th worst death toll per capita. Scientific superpower. That is what I call the epitome of science and the epitome of health. That is incredible, just incredible from Boris Johnson. And let's talk about test and trace, because the BMJ tells the BMJ writes, we must stop being polite about test and trace. There comes a point where it becomes culpable. The test and trace failed for months. For months it failed. There was reports of these test and trace callers being paid thousands and doing nothing, doing like 1 or 2 calls a day. And it failed for a very, very long time. It's finally got working, which is good, but it has failed and failed and failed. And as I've said before, 3 or 4 U-turns is fine, but 10 and 12 U-turns, even more. Now I've lost count of the amount of U-turns that this government have made, but time and time again the U-turns have kept happening. And let's talk about the mutant algorithm, it was called. Let's talk about that, because the Tory government, they have a lot of people who have gone to private school. A social mobility charity, Upreach, reported they found that the A-levels and GCSEs were in favour of people that went to private school, and these were a lot nicer to people that went to private school. Once again, Tory cronyism at work.
I don't accept that though, because Gavin Williamson didn't go to private school and he runs that department. Okay. And to add to that, the reason that the private schools benefited from the algorithm was because historically private schools have got better results than state schools. We all know that. Okay, it's just the reality. And yes, it was a bad algorithm in the end, because we saw that it discriminated too harshly against people. But in reality, that mistake was resolved. And I want to also pick up on the tracing point you made when you're saying that they were sitting at home doing nothing. I would say one of the reasons for that was that the tracing system was actually set up during the trough of the pandemic, when it came to cases and hospital admissions and the infection rate. It was actually set up during the summer, which, as you remember, especially August, we had very low case numbers and death numbers. Sometimes the death numbers were in the single figures daily, I seem to remember. And the reason that now it seems as though it's operating properly and working is because those people actually need to be traced, whereas we didn't have those people to be traced in the first place during the summer. That's just reflecting the actual curvature of the cases of the COVID infection rate as well. So I think they're very they completely correlate there, and you have to look into that to be able to, I think, make your point educated.
Okay, well, 3 out of 10 people were missed. Close contacts were missed in the test and trace system. That's just in Cumbria, not even correcting the rest of the country. Let's talk also about the Tory government. 2/3 of them went to. This is just the cabinet. 2/3 of the cabinet went to private school. It doesn't matter that one of them didn't. 2/3 of them did. They all talked together. Gavin Williamson's boss is Boris Johnson. So, and Boris Johnson went to Eton. Boris Johnson's, all his kids have been to private school. This is a government that is still posh, white, old males running our country in very.
You go to a private school. You're white and male, aren't you?
So I'm not 2/3 of the cabinet. That does not make, because I went to private school has nothing to do with this. 2/3 of the Tory government went to private school, and then private school are benefiting from this mutant algorithm. I wonder how mutant it really was. Let's talk. Daniel Jones, and then I'm going to finish this off.
So I'm looking at France versus UK in cases. They've got more cases than us, but they've got but we've got around. So this is but they've got 10,000 less deaths than us, but so we've got the highest deaths in Europe, I think, but or it might be Italy, but I think it's to do with how we count death.
Yeah,
because we have 28 days after a COVID.
Okay, well, let's talk about this.
Sorry, Karen.
I think that what you're missing here is it's per capita. It doesn't matter about how many deaths it was, it's per capita. Because I could have a country of 2 people, and if one person gets COVID-19, that looks really good for my country. But if 2 out of 1 people get COVID-19, that's terrible, right? So there is a very big difference between deaths and death per capita.
That's how they count their deaths.
Okay, sure, but even still, it doesn't matter. If we're the worst in Europe, there is a big enough margin for error that something has gone wrong, right?
It really does matter, because France has more cases than us. Error.
If you're
and less death,
the worst in Europe,
and they have a very similar population to us.
No, but it's deaths per capita, and they have less deaths per capita than us. So I think you've wildly misunderstood deaths per capita on that point. But I think there is a big enough margin for error there that even if we counted like all of the COVID deaths possible, and they counted like half of them, there's still a big enough margin for error that this is not a big issue. Tommy.
Well, I think I want to just, instead of sugarcoating, I think test and trace has failed. They lost many tens of thousands, I think it was, results and tests because it was on a spreadsheet, Google Sheets it may have been. The government have access to resources and they choose to lose it like that, I guess. I think also the signals they're sending out about the U-turns, eat out to help out, go back outside, no, come back inside, we're going to go on a lockdown, but then some of you can go out and then some of you can't. We're going to keep changing it accordingly, but sometimes it won't make sense at all because we prefer certain areas.
Yeah,
I think it's just been very bad on the government's part about U-turns. Like you said, 3, 4, 5, 6 even would be acceptable, because it is a pandemic, it's unpredictable, people behave differently. But I think with the tier system, what I've noticed, I've seen people that have gone to places, because we are currently in tier 4, I have seen people that have packed their bags and gone to places that are tier 3 or tier 2 to meet family for Christmas and New Year's. That is against the law, I believe. But it's hard to enforce.
Did you see of all people, Nigel Farage's Twitter? He put up a video of King's Cross on the day tier 4 was announced. It was packed, absolutely packed with people trying to get out, and the messaging has been all wrong from this government. It's another very good point. I don't want to get into it now because we've had a very long episode today. But yeah, you make 2 very good points there. Thank you everyone for being here. That was quite heated, but I enjoyed it a lot. Thank you all for coming on New Year's Day. I really appreciate it. Yeah, thanks for watching. Cheers.